The carotid arteries are the main blood supply to your brain. There are two of them, located here and here on either side of the neck. There are other smaller blood vessels that travel through this area, but the carotid arteries are the main pipeline. You know how frustrating it is when the only major freeway is backed up? Your blood cells feel the same way about backups in the carotids too. Only in this example, significant plaque buildup and blockages can impede blood flow to the brain and cause a stroke.
I think it's important that people be aware of the prevalence of carotid artery disease. Basically, there are about 750,000 strokes in the United States every year, and probably about a third of them are caused by disease or blockages in the carotid arteries. So it's a very common problem, and fortunately it's very easily diagnosed with a simple ultrasound.
Once diagnosed, there are two ways to treat it: by implanting a stent or with a surgical operation called an endarterectomy.
Endarterectomy is just a fancy word for cleaning out a blood vessel. And basically what we do is make a small incision on the side of the neck. We go right down to the carotid artery, open it up, clean out all the plaque until it's wide open. There's a special instrument. It's kind of like a mini spatula. And actually we scrape the plaque out of the artery. It usually comes away very easily. And we restore the artery to its original lumen. In other words, it's almost completely open after we're done. And patients usually go home the next day.
Most patients are asymptomatic prior to diagnosis, so they don't feel any physical results after the surgery.
What I stress is that the purpose of the surgery is to reduce the chance of having a stroke. So the patient's not going to feel any different except for a small incision on the neck. But again, the important point is they're no longer at a high risk of having a stroke. We monitor patients every 6 months after the surgery for the rest of their lives. And fortunately, with the type of procedure we perform to do the clean out, the incidence of a significant blockage coming back is very, very small, almost zero.
Endarterectomy is recommended over stents for specific patients. Patients older than 80 years old, patients who have a lot of calcium in their blood. Calcium buildup can impede the effectiveness of a stent. Patients who have a tortuous or very curvy carotid artery. That curvy tract makes it difficult to lay a stent straight. Patients who have a significant blockage in the carotid artery, especially those with an 80% or greater blockage.
We follow many, many patients with just 30, 40, or 50% blockages, and we find that over several years they may increase. The critical percentage is 75 to 80%. We know that when somebody develops that much of a blockage, that their risk of having a stroke suddenly increases many, many times over having a blockage less than 80%. It doesn't make it an emergency, but it makes it something that we really need to address and to pay attention to.
Living a heart-healthy lifestyle can help prevent carotid artery disease. That includes eating a healthy diet, control high blood pressure and cholesterol, exercising regularly, and never smoking. Your circulatory system will thank you. Wouldn't you love it if you never suffered through bad traffic? I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.